Your cervix came back with something significant enough that it requires removal. What is a LEEP? You've heard of it before, but what do you really need to know? Hi, I'm your local OBGYN. I love women, and let's talk about it. LEEP stands for loop, electrode, excision, procedure. So it's kind of like a medical grade cheese cutter that has a small wire that has current and heat that goes through it. So when it touches tissue, it burns and is able to kind of carve out the tissue as it's directed through it. This means that you don't need a lot of stitches and poking and prodding of that tissue once that area is removed, which is perfect for a deep cervix that has a lot of blood vessels to it. Now, do you need to worry about this? The nerves in your cervix are not the same as like the nerves of your skin. So once this procedure is done, you might feel crampy, but you're not going to feel too much in the way of like overt pain, like that you're going to need like narcotics or something for. But the crampiness after the procedure can be there. The procedure takes just a few minutes, but we'll generally do it in an operating room these days. Once upon a time, they could be done in an office. Some places still do it that way. You need somebody who is not nervous and can sit still. That being said, the whole procedure, when it's done, we put some solutions or topical things on to help the area stay dry without any excess bleeding. When you go home, there will be no baths, no swimming, and no sex for a little while in order to let that area heal. The discharge can be quite abundant, like a lot of it in the healing process. And then what's kind of neat about the cervix is a few weeks later, when we re-examine it, it looks pretty darn good. The ultimate goal is hopefully whatever was removed with the procedure has clean margins and the abnormal cells are gone, so you've significantly reduced your risk of whatever was there progressing on to something more concerning.